I am going to do a little brief presentation on 10 ways to improve your health for women, and I'm hoping to go a little bit beyond the basics. I think everybody could brainstorm that I'm going to say maybe get a mammogram and have a pap smear and all that, which I am, but I'm hoping to go a little bit beyond the basics and give some new information. So this will be 10 ways to improve your health for women. So number one is know your numbers. And the reason I have this one on here is because a lot of people come to my office and they don't want to know their blood pressure. They won't look at the number on the scale. When I ask them their cholesterol, they say, oh, I think it was high last time, but I don't want to have it rechecked. And, you know, it's hard to make improvements if you're not willing to look at where you are. So it doesn't mean that where you are is good or bad, but everybody needs a starting point. So if you can have a sense of what your numbers actually are, and I've listed the ones that I think are most important. So that would be cholesterol. TSH is a thyroid value. Vitamin D3, we're all vitamin D deficient here in Montana, so it's good to know that. Hemoglobin is your red blood cell count. Fasting glucose is an indicator of diabetes or prediabetes. Blood pressure, weight, body mass index, and then the one I think people typically don't know is their basal metabolic rate. And basically what that is the number of calories essentially that it takes your body to function on a daily basis. That one, basically, if you go on the internet, you can type in basal metabolic rate calculator, and you can get an estimate by entering your age and your gender and your weight and height, and it will give you essentially an estimate. So mine, for example, I'm 42, I'm 5'9", it comes out at around 1,300 or something. So for me to stay this exact same weight and for my body to function normally, I get a budget of 1,300 calories a day. If I also exercise and run around and run 10 miles, well, then that's a different number. But in terms of what's my basal metabolic rate, it's really not that much. So I think a lot of times we see those food labels and they say 2,000 calorie diet, and we all assume that we have 2,000 calories to work with when we don't. So that one is an online calculator. And it is pretty eye-opening for people to learn that. You can also, a lot of gyms or weight loss clinics will have an actual gadget that you can stand on, and it does this bioimpedance, and it will tell you something that's more accurate for your specific muscle mass and body composition. But you can get a ballpark figure that's plus or minus 200 calories just by using an online calculator. Okay, number 2 is plan pregnancy. I have plan italicized there because I'm a gynecologist, right? So people come to my office all the time and I say, what are you doing to prevent pregnancy? And they say, oh, we're being careful. Oh, nothing. And I say, oh, so you're planning a pregnancy? And then I get, oh, no, I'm not planning a pregnancy. You know, so then this is how we get basically 50% of pregnancies are unplanned. So pregnancy is really important to plan. It's a stress on the body. We do have excellent contraceptive options available for all people, no matter what your health history is. You can, there is definitely going to be some sort of pregnancy prevention strategy that works, and I do recommend thinking this through, having a strategy, and actually using it. Unplanned pregnancy is certainly not only a financial and emotional stress, but can also be a very significant physical stress. People have a lot of times chronic health conditions, or they're taking medications that are potentially harmful to pregnancy. Maybe they're binge drinking, or whatever else people do these days. And a lot of those things essentially can and should be optimized before becoming pregnancy. So certainly pregnancies that are planned are healthier, less taxing for people, and if you are someone who has a chronic condition like diabetes or high blood pressure or MS or whatnot, those things can be optimized before you become pregnant and give you the best chance of having a pregnancy that's not taxing to your body. we're being careful is not a contraceptive plan that is effective. So I hear that every day. That's why I have that there. Okay, number 3 is know your cancer risk. And there are several components to this. So for sure, the ones that many of us already know are mammogram, pap smear, and colonoscopy. Surprisingly, there are only screening tests for women for 3 types of cancers. We have mammogram to screen for breast cancer, we have pap smear to screen for cervical cancer, and we have colonoscopy to screen for colon cancer. Every other cancer, there is no screening test for. That means you can't come to my office and ask me, hey, do I have liver cancer? How do I know? Do I have pancreatic cancer? I want to test for uterine cancer. I want to test for ovarian cancer. I want to test for lung cancer. We don't have tests for those things. But we do have tests for 3 very common cancers, which are breast cancer, cervical cancer, and colon cancer. There's a lot of misconceptions about these things. Certainly the pap smear guidelines have changed literally every year for the last few years, and people are very confused about that. Your specific age and pap smear result history and medical history determines how often you need pap smear, so I'll leave you to work that out with your individual gynecologist, but the intervals range anywhere from 1 to 5 years at this point. Mammograms, big misconception about that. There's been a lot of media around mammograms and people feeling like mammograms cause cancer and people avoiding them because, what I hear often in my office is, oh, well, I don't feel any lumps or anything, so I don't need to have that. And the idea behind mammograms is that essentially they can detect a cancer, a breast cancer, before you feel anything. So by the time you feel a lump or a lymph node or your skin is dimpled or you have some sort of physical finding, usually that means a larger, more advanced stage of a tumor or a problem that then requires more invasive and more extensive treatment. A mammogram can find a cancer, a breast cancer, that is microscopic or very small in size, which then means the treatment is much easier, it's less invasive, it's less intensive, and the recovery is much quicker. Also, your long-term prognosis is better the earlier a cancer is found. If you've ever been to the dentist, a lot of times ladies say, oh, I don't want to go and get my mammogram because it's painful and it's terrible and it's going to be awful and my friend went. And if you've ever been to the dentist and you've had an x-ray of your teeth and they put your, that gadget in your mouth and then they position you and you're like, like this, and then they run out of the room and hit a button and run back in and then reposition it. It's literally the same thing. So you stand in this sort of area, you put your arm around the machine like this, and then there's like a plastic sort of a plate that sort of compresses your breast in between there. You stand there, they say hold still, they run out of the room, they hit the button, and they run back. So it's really quick. It literally, the last time I had mine, I think it took me less than 10 minutes to do the entire thing. In terms of intervals, how often should you have this? Usually it's recommended to be roughly every 1 to 2 years between 40 and 50, every year after 50, and then the screening guidelines are a bit different if you have a family history of breast cancer or you yourself have had a cancer, then the guidelines are different. But for someone, just average person, no family history, first mammogram, age 40. In terms of the radiation, if you've ever flown in an airplane from here, Bozeman, Montana, to New York City, you've received the same amount of radiation during your flight as you would during your mammogram. So I don't know of too many people who are not flying because they're afraid of radiation. I would say the same for mammograms. Early detection, I think, outweighs any potential risk of the minor amount of radiation that you get by having a mammogram. What else is on my list? Okay, colonoscopy, screening test for colon cancer. That first one should be age 50. The colonoscopy itself is very easy because you're sedated and you don't remember anything. The part that's terrible about it is essentially the day before you drink some very delicious stuff that gives you diarrhea and cleans out your intestine so that when the camera is inside your intestine, they can actually see something. I've never had anyone complain to me about the procedure itself, but everyone complains about the bowel prep, so that's the worst of it. The good news is if you have the colonoscopy and you get a good result, then you're off the hook for 10 years. So essentially, first one at age 50, and then if that one's normal, the next one wouldn't be till 60. Skin check is done by a dermatologist. They can help you look for melanoma or any abnormal moles or lesions that you have. And then the other two that I have on there are genetic counseling and family history. A lot of times people have a very significant family history of cancers, different types of cancers, female cancers, and some of those things are amenable to genetic testing and even preventive type screening that's a little bit different from the norm. So if you have a strong family history of cancer, we actually have a genetics counselor here that we can link you up with, and they can sort of figure out what is your risk of certain types of cancers based on your genetics. And then other things, these are ones we know. Smoking, of course, increases our risk of lung cancer. Obesity actually increases your risks of many different types of cancer, including uterine cancer. Exposures to different chemicals, certain immune suppression type medicines, and then hepatitis C can increase your risk of liver cancer. So these are things to know about yourself, essentially, and get the screening if you are in the right age range. Okay, this one you guys knew I was going to say, right? Improve your health by moving around. I've highlighted there, oh, you can't see it on the screen. Sorry, I'm talking about what I have highlighted on my screen, and then you can't even see the screen. That's very funny. Okay, well, on my screen, I have highlighted easy and fun. So what that means is I'm not talking about when I say move your body like going and training for, an Arctic expedition or a marathon or something extreme like that. I'm talking about like walking around, walking the dog, going for a walk with friends, maybe riding your bike to work, going for a hike, something like that. Maybe doing a little stretching. Some people like yoga, swimming in the lake, something fun, something easy, something that you're not dreading. And any amount of moving around essentially improves your circulation, it improves your mood, it can reduce stress. There are essentially no chronic conditions that are not improved by a little bit of activity, and it can lower your blood pressure. So I'm not going to belabor this one, everyone knows this, but the key I think is to, sometimes people say, well, I don't want to go do anything because I can't run 5 miles, and you don't have to run 5 miles to get the benefits of activity. It can just be, a walk outside for 15 minutes and that's good. Okay, number 5 is prioritize mental health. And I think, I did a whole presentation on stress reduction and mental health on a different video, I think. So everybody can see that one if they want to hear about it for an hour. But I think a lot of times as women, we are really good at taking care of everybody else and, prioritizing everybody else's needs and wants and, our kids and our families and our work, and we sort of give ourselves the leftovers at the end of the day, and we are reluctant to put ourselves in a position to get our own counseling, take rest for ourselves, do our own self-care, attend to our own relationships, and have our own fun. So we're doing what our kids find fun or what our spouse finds fun or, that sort of thing, but we don't always do what we ourselves enjoy or attend to ourselves as optimally as we should. And so certainly prioritizing our own mental health, stress reduction, and rest can be extremely beneficial. I'm not going to belabor this point because certainly we all expected me to say this, right? Hopefully You guys expected that one. Okay, number 6, I have protect your bones. Maybe not everybody knows about osteoporosis, or they think, oh yeah, that's something for, old ladies, and that's not necessarily true. So everyone who is female essentially has one risk factor for osteoporosis, and that is that they are female. Other risk factors are being Caucasian, having a family history of osteoporosis, being in menopause, taking certain medications, and being thin. Osteoporosis essentially is weakening of the bones, and it happens at an accelerated rate after menopause for ladies. And it can be very debilitating and problematic. So what can happen is essentially the bones in our spine, the vertebrae, instead of being nice and flat like this, they can collapse in the middle. So just walking around, we don't have to have an injury or anything. Our vertebrae collapse. The other thing that we see is just people coughing and sneezing. They can break their ribs, or if they fall, even a minor fall, you can break a wrist, break a hip. And these things can be very debilitating for people. So what I often see is people completely ignoring their bone health until they're, 65, and then they've fallen and they've broken something, and then now they're in my office and they're like, oh my gosh, what should I do about this terrible osteoporosis? And what I would suggest is that we take a more preventive approach, a more proactive approach, which means when we're premenopausal, or whatever age you're at, but especially if you're premenopausal, we want to keep our bones as strong as we can. And that means not smoking, getting enough calcium, getting enough vitamin D, and doing weight-bearing exercise such that our bones are strong. It also means, really importantly for all ladies, the best thing you can do is maintain strong muscles. So your muscles will support your bones. Even if you have weak bones, if you have strong muscles and good balance, you're less likely to fall and break something. So what all of us can do, starting at whatever age we are, is get in the habit of really strengthening our muscles and doing balance type exercises. And that helps not only protect our bones, but also really protects us from falling. And falling is like so hazardous and extremely dangerous. And so I would say whatever age you are, if you can really think about, at least keep in mind that your bones and your bone density is potentially important to you, even if you're 25 right now. You want to get in the habit of keeping good balance, doing exercises to maintain your balance, keep your bones strong, or keep your muscles strong, and getting the right nutrients. Okay, number 7, I have keep your vaccines updated. No one likes to talk about vaccines, and certainly there's a lot of media on this as well. None of our modern day vaccines have mercury in them or thimerosal or any of that. That's old news from years and years ago. I hear a lot of people say, I don't want to get this or that vaccine because it has mercury in it, and that in fact is not true. Vaccines for women that are important are HPV vaccine, which is human papillomavirus. That's typically for younger girls starting at age 12 up through 25, I believe it is. But certainly the younger the better. That one can help prevent cervical cancer. We have Tdap, which is tetanus, diphtheria, and pertussis. That's the one typically we get in pregnancy, during pregnancy, that protects the mom and also protects the baby from whooping cough, which is pertussis. Flu vaccine comes around every year. There's no reason that any of us working in a hospital should not get a flu vaccine unless you're specifically allergic to some component of it. We also have pneumococcal vaccine, shingles vaccine, and then certainly, if you're traveling or I traveled overseas and I had to get all kinds of stuff, yellow fever and rabies, and I was like pincushion vaccine lady there for a second. But vaccines do prevent they help us not get diseases that we don't need to get. So if you are a candidate for a vaccine, literally there's no reason to not get the ones that are recommended. Okay. Number 8, I have maintain a healthy weight. Everybody knew I was going to say this one, right? I'm going to hopefully say a few things maybe you haven't heard before. So first of all, we can use our basal metabolic rate that I talked about in number 1, know your numbers. Basal metabolic rate being one of them. That's the one that tells you what your basic calorie needs are for one day. And we can use that as a guide. It's really important to have a healthy weight. So I'm not talking here about like looking your ideal way in a bikini or like a cosmetic weight. I'm talking about weight as a health parameter. And so for that, typically you want to try and target something that keeps your body mass index below 30. Body mass index above 30 is considered obesity. And that's sort of the line at which once you cross over that body mass index of 30, your weight becomes a risk factor for your health. So what I'm talking about here is trying to maintain a weight such that your body mass index is less than 30. And if you want to know your body mass index, basically you put your height and weight in a body mass index calculator online and it will tell you what number you are. Being obese or overweight is an independent risk factor for many chronic diseases. Also, the fat on your body, once it reaches a critical mass, it starts behaving like its own organ. It secretes hormones and chemicals and toxins that make you feel crappy and make you feel sicker, essentially. One of the things it secretes is estrogen, and so a lot of ladies will experience an excess of estrogen because they have too much fat on their bodies, which is giving them a hormone imbalance. So I have lots of people coming in saying, I think my hormones are out of whack. And yes, they probably are. And a lot of that comes from too much fat on your body and that fat secreting estrogen. Also, being overweight really affects the people's ability to participate in life. And so when I did the weight loss clinic for several years, I heard stories from people, things like, I can't wear my seatbelt in a car. I can't fly in an airplane because I don't fit in the seat. When my kids go and play soccer, I'm the one stuck standing there holding the coats and everyone else is running up and down the field. Really, I would say tragic stories of people not being able to participate in their own lives just because of their size. And certainly, we as healthcare providers have great compassion for that problem, and we also really, really encourage you to tackle this one head on. A lot of times people feel like it's only a cosmetic issue, and I would say it's an extreme risk factor for health. And there is help available for people who want it and who need it, and it's not necessarily only a cosmetic thing. So we do have help available, and I would say talk with your doctor about that. Also, if you're looking to do it on your own, the path to weight reduction is always 80% diet and 20% exercise. So I have people who come to me all the time and say, I've tried everything and I can't lose weight, and then they list 7 different exercise programs that they've tried. And that's good. I want everyone to exercise. Move your body was one of my things, but really you're tackling 20% of a weight problem with exercise. And as my friend who works in the gym says, abs are made in the kitchen. And that's true. So pretty much 80% of weight reduction comes from nutrition and basically what you're taking in. And then, like I said, this is a hot topic. A lot of people are very aware of this, but it's not, of course, it's not as easy as you might think, and help is definitely available, and it is critical importance to your health. Okay, number 9, kind of along those same lines, I have increase nutrients and decrease toxins. So nutrients, These are things like vitamins, minerals, healthy fats. My stress management presentation, I talked about the importance of vitamin D3. We're all deficient in vitamin D, essentially, here if we live in Montana. Pretty much anyone who is not exposing half of their naked body to the sun every day for at least half an hour is deficient. So I don't think that's any of us unless we're running around shirtless in the middle of winter. But vitamin D supplementation is readily available, and the test is easy. Just a simple blood test can tell you your number. For sure you want it to be above 30, in the range of 30 to 50 is a normal number. This time of year, spring, I'm seeing numbers like 4, 6, 10 coming out of winter. And vitamin D really affects your mood, your immune system, your bone health, your brain health. So very important. Also, omega-3s. A lot of us are deficient in that. Good supplements have a combination of DHA and EPA, and you can find those in Costco or Rose Hours. I've seen them both there. Reducing toxins. We all know reduce alcohol, reduce tobacco. Maybe not as many of us are aware of reducing our electronics exposures, our exposures to stimulants, which would be like caffeine and energy drinks and supplements. And then also I have negativity listed as a toxin. It seems like we all love to run around and complain to each other, and I do it too, so I'm as guilty as the next person. But decreasing exposures to anything that's negative, and of course now we have a lot of negative news and media. Just be aware that those things do in fact affect you, and to the extent that you can reduce those types of exposures, the better. Another one that people have probably heard of but maybe don't know too much about would be the microbiome. So basically that's a fancy word for your gut bacteria, all the bacteria that live in your intestines. We need to keep those guys healthy so that we can digest food properly. Also, those bacteria affect our mood, believe it or not. So to the extent you can maintain a healthy gut bacteria, that comes from eating a lot of nutrient-dense foods, like fruits and vegetables, of course. Also, some people will take probiotics, which can help that. That's especially helpful if you're someone who takes a lot of antibiotics for different chronic conditions. So that's definitely something to look into as far as increasing nutrients, decreasing toxins. And then number 10, I'm a gynecologist, so of course I have to put manage menstrual cycles on here. All day long I have people coming to my office and they're telling me stories about how their periods are ruining their life. We have modern treatments so that your periods do not have to ruin your life. There are lots of options. It's not just birth control pills anymore. It's not just IUD. It's not just hysterectomy. There are many, many options for people who want to lighten periods, skip periods, eliminate periods. You don't have to suffer every month for a few days unless you are having normal cycles. This is also true for menopause. So as we go through menopause, it's part of normal aging. Sometimes people have extreme symptoms from that. I've seen people have hot flashes so severe that they can't drive their car, night sweats that they can't sleep, and mood changes, vaginal dryness, skin changes, hair changes, and those things are all normal as long as they're not ruining your life. So if it's so severe that you can't drive your car, this is not something that you need to live with. You can, and we do have ways to help with these things. And then also we have sort of the opposite problem, which is once we pass through menopause, really we should not be having bleeding anymore. And if you have gone through menopause and a number of years has passed with no periods, and now all of a sudden you start bleeding again, that's very important to have evaluated immediately. So just in this past week, I've had 2 ladies come with this postmenopausal bleeding, and the story is, well, I've been bleeding for about 6 or 9 months, but I just thought it was normal. I just thought my period started up again, and in fact, it's uterine cancer. So both of these patients had uterine cancer. So if you see bleeding and you're in menopause, that needs to be evaluated immediately. Please don't wait 9 months to do that. And then certainly routine gynecology evaluation, even if you're not having any problems, just your once a year annual female wellness check is indicated for all ladies. So I'm going to just recap really quick here from number 1. So number 1 was know your numbers. Number 2 was actually plan your pregnancies. Number 3 was know your cancer risk assessment. 4, move around, something easy and fun. Number 5, prioritize mental health. Number 6, protect your bones. Number 7, update vaccines. Number 8, maintain a healthy weight. Number 9, increase nutrients and decrease toxins. And number 10, manage your menstrual cycles. And that's it. So if you follow all of these things, you'll be very proactive about your health, and you win. That's it.